Sepsis is the way the body responds to infection. So it's always triggered by an infection, but in sepsis, there's a dysregulated host response. It's mostly the immune system going into overdrive, but if we don't stop it, the body starts to attack its own organs and tissues. And unchecked, this will lead to multi-organ failure and often death. There are a number of factors which make rural populations different to other populations in terms of their access to healthcare and their risks of infection of sepsis. The first and most obvious is geography. They're less densely populated, the distances to hospital are often much greater, but moreover, access, particularly to land vehicles such as ambulances, can be challenging. The second is the resilience of rural populations, and particularly those in the farming community. They're accustomed to having cuts and scrapes as part of their daily life. They're accustomed to feeling under the weather, but the ethos is to soldier on regardless because the community, the crops, the animals, the livestock need them. The third is that there are, of course, specific risk factors for people in rural populations. On a farm, minor injury is an occupational hazard. It's part of the working day. But of course, machinery can be dirty, it can be contaminated with animal feces, with manure, with other substances that increase the risk of infection getting into cuts and scrapes. Occupational hazards also extend to substances being inhaled into the lungs, particularly of farmers. And farmer's lung is a condition that we describe for an occupational lung damage. COPD or chronic airways disease is also common among rural populations, and these conditions, along with conditions like diabetes, increase the risk of infection. All of these factors mean that people in rural populations are not only at increased risk of sepsis, but also when they do realise they're critically ill, they might present later to healthcare and have more difficulty accessing healthcare rapidly. The first thing health professionals working in rural populations can do is, of course, to make themselves and those around them aware of the dangers of sepsis, to educate their staff, those in their healthcare community, around what to look for and when to urgently send patients to hospital. If they're prescribing antibiotics to patients, it's important that they safety net, and that would be most effectively done with written as well as verbal safety netting instructions, educating their patients what to look for and when to access healthcare, and reinforcing how important it is that they do so. And then particularly in high-risk groups, and that will include people in rural populations with conditions that place them at increased risk of infection of sepsis, obvious ones being diabetes and lung conditions such as COPD. It's important that they consider how they can educate those people, even in health, to be aware of the signs of sepsis and to know what to do if they're worried. Within the UK, sepsis is subject to a guideline produced by NICE, and in November of 2025, this guideline has been updated. So it's important that health professionals be familiar with this and understand their role in recognising and managing sepsis. But of course, academic guidelines are all well and good, but in a busy practice, in a busy healthcare environment, it can be difficult to recall everything that's written in an academic guideline, and that's where the UK Sepsis Trust comes in. What we do is provide pragmatic, operational tools for health professionals working in any environment, whether that be in the community, in hospital, or the back of an ambulance. We provide tools for people of all ages and include women who are pregnant, as well as other special and at-risk groups. And these tools are available on a single side of A4. They can be integrated into electronic informatics systems, and they're not there to replace clinical judgment, but they're there as important aid memoirs and decision support tools to help you make the right decision for your patient. And then finally, the UK Sepsis Trust can, of course, offer education to health professionals who have an interest in this condition, as well as providing support to their patients.